commenced, and we thank God for making it possible for this program to start. Now, before I welcome our first guest speaker, please let's have a short profile of our first guest speaker. Now, she's a person of faith, Ohale Onakweseha. She is a pharmacist, and she's currently an intern doctor at Jiangsu Medical University, China. She believes that patients should be the physician's first priority. She's believed in God. Her interest is finding solutions to the needs of people through medicine and prayers. Her potent combination with never fails. Our world can be disease-free if we are able to impart basic medical philosophy into the minds of people. She holds a bachelor's degree from Igbenidion University, Okada, Nigeria. That's where she obtained her first degree in Doctor of Pharmacy. Currently, an intern doctor at Jiangsu Medical University. Let's look at her hobbies. Her hobbies are, she loves reading, music, and watching movies. Ladies and gentlemen, please let's welcome Dr. Faith Onakweseha. Thank you. Dr. Faith, please, you are welcome.
Okay, thank you so much for having me today. I hope I pray that even as we come together, I will be blessed and learn a thing or two. And I hope that we'll leave here with new insight and knowledge about what we're going to learn today. Like the flyer said, we are going to talk about uterine fibroid. Uterine fibroid. I don't know, please, can you share the slide, the PPT, so that everybody can see the screen? Okay. Okay, thank you so much. If at any point you can't hear me, you can also tell me so that I can, yeah, thank you. So today we are going to talk about uterine fibroid, and fibroid is something I believe we are familiar with. We might not necessarily know what it's about or what exactly it is, but I believe maybe most likely would have heard about it one way or the other. And fibroid is also known as uterine myoma, or you can call it uterine leiomyoma. I remember the first time we talked about myoma in school, it was actually myoma is something that's related to tumor. And yeah, fibroid is actually a tumor, but it's a benign tumor. That's the first thing we have to know. It's a benign, and it's very common in females. And it occurs most of the time in women that are within the childbearing age. And childbearing age, from a time where you are a lady as started menstruating to when it stops. We're not trying to say that it doesn't occur during menopause, but it occurs mostly during childbearing age. And it's very common in reproductive women. Obviously, childbearing age are people that can reproduce and give birth to children. Yeah. And when we talk about fibroid, as common as it is, its pathogenesis, how it comes about, how it happens, is actually very unclear. There is no specific reason as to why people have fibroid. Can you move it to pathogenesis, please, Williams? Okay. It's actually very unclear. There's no specific reason, but there are some speculations that fibroids can be as a result of hormonal imbalance. Looking at our body as females, we have, as we mature and get to a particular point, even as we grow, our body secretes estrogen and certain hormones that are necessary for us to exhibit secondary characteristics. And these hormones are necessary for the survival, or probably, would I say, for the maintenance of the body and how it's supposed to function. So in a situation whereby there is an imbalance, it causes fibroids. We are not saying that if your body is imbalanced, you must have fibroid. No, we are saying that one of the speculation as to why people have fibroid is one of the things to be hormonal imbalance. And also we see genetic predisposition, environmental factors, steroid hormones, that's what talk about the estrogen and the progesterone, growth factors also play a role, and even the food we eat also play a role. Our lifestyle play a role in also how fibroid is being formed. Going further, we can classify fibroid based on its location. If you see the uterus, going to the next picture, I just want to focus on the first one. Yes, thank you very much, this picture. We see the first picture has like two boxes. We have the green one that is highlighted and the under, which is highlighted with red. The upper part, this is the picture of the uterus. This is how the uterus looks. The upper part is the corpus. Okay, we're not doing anatomy here, but I just want us to know where it's most likely located, where fibroid is most likely located. The upper part is the corpus and the lower part is the cervix. That is close down to the vagina. That's where the cervix is located. After the vagina, then you go up, you find the cervix. Then the upper part is the corpus. Fibroids always, most of the time, 90% of the fibroid occurs in the corpus area of the uterus. And a few percent, like 9%, 10% occurs in the cervix area. So that's what we see. And according to the relationship that fibroid has, that's the myoma, like we called it at the beginning, with the uterine myometrum, we have different areas. Okay, for the second picture, we see that the uterus has different, we have the inner lining, the middle lining, and the outer lining. You see the middle part is called the myometrum, the inside part is called the endometrium, while the one outside is called the serosa. Most fibroid occur in the middle area, which is also known as intramural myoma, where it's at the middle part. That is because we know fibroid, like we said, is a proliferation like of the middle part, the mucus, the smooth muscle cell of the myometrum. That's the muscle area of the uterus. I don't know if we'll get to what I'm trying to say. If you don't understand, you can ask a question as well. So that's how we classify fibroid. So when a person, because the reason why we are actually explaining this is because the symptoms depends most likely sometimes on the location. So when a person begins to see symptom, it shows, okay, this fibroid is in certain part of the uterus. So that way you can actually identify, okay, where is this fibroid located? Okay, we'll go further to the next part, symptoms of fibroid. In as much as we have talked about this whole thing of fibroid and all, we have to know there is no way we can go into our body and see it without actually assistant examination, like using ultrasound and all those things. But how do we know a person has fibroid? Firstly, we should know that fibroid doesn't have symptom. Most of the time, there is no symptom. And the symptom of fibroid is based off of the location or the speed of growth and the degeneration. That is when it begins to show symptom. At the beginning, a person might have fibroid and don't have symptom because of the location might not be a place that, okay, it can press and other things. So we'll go further to see the symptoms. Then when we see the symptom, we'll be able to understand what I mean by press, because this is a mass on its own and it can press certain organs in the body, resulting in various symptoms associated with the organ that is being pressed. So firstly, the first symptom and the most common symptom of fibroid is abnormal uterine bleeding. Secondly, abdominal mass. Thirdly, leukorrhea. Fourth, abdominal pain. The fifth symptom, pressure-related symptoms, infertility and spontaneous abortion and anemia. I would explain everything one after the other. Abdominal uterine bleeding is the most common, like I said, and it has to do with when a person has prolonged heavy menses, when on a norm. That's why it's important for us to actually know how our body works, so that we'll be able to know, okay, is something wrong with me? Have I been feeling this way before? Imagine a person started menstruating, or maybe at a certain age, at 10 or 11 or 12, and their normal cycle or their period of menstruation is like 5 days. At the end of the day, maybe later on, it increases to 10 days, 12, then there is a problem. So prolonged heavy menses is one of them. Premenstrual spotting. This is when a person, before their period, they're supposed to start maybe they are after the 28-day cycle, they're supposed to start their period. But before the period comes, they know, okay, I'm supposed to be on today's 6th of, okay, here in China it's 7th of August. So maybe they're supposed to start menstruating on the 8th of August. And on the 8th of August, they will actually menstruate properly, like blood, everything. But before that day, they are having spotting, which are like drop of blood that might not necessarily need a menstrual pad. That's what spotting does not, most times don't need menstrual pad because it cannot stain a person. It's just like drop of blood that are just there, here and there. So you see premenstrual spotting. Spotting on its own, it's not a bad thing, okay, in certain situations, but in other situations actually, but we are not talking about those other situations today. We're just focusing on the fibroid. So when a person has premenstrual spotting or prolonged light staining fluorescences, it's actually one of the symptoms. Secondly, leukorrhea. This is like a profuse vaginal discharge with abnormal change of color. So it's, like I said, it's important to know your body so that when there is a change, you can tell and be able to know, okay, something is wrong somewhere. So having like abnormal discharge, so when you know, okay, this is how my body is, I know the type of discharge I normally have. And I'm being heard, please. My net, okay, I think so. When you know the way your body, the normal discharge that's supposed to come out of your body, when you notice that there is an abnormal change, the smell, the texture is different, it's important to go to the hospital and get yourself checked. So this leukorrhea is as a result of the myoma increasing the size of the uterine cavity and the endometrial glands, and also infection of the submucous myoma. This is what causes leukorrhea. Thirdly, pain. Pain in fibroids is as a result of degeneration. I will not really go into details as to why we are talking about degeneration here, but degeneration in its own way, in summary, per se, has to do with like after the person has the fibroid, there is this breakdown. When you hear degeneration, like what are the things that now happen in the fibroid? Because there are various like type of degeneration, and these types of degeneration tend to result in other things. So degeneration in its own can actually cause pain in fibroids, and infection can cause pain. Torsion is like a twisting of the myoma, which is the fibroid. Looking at the picture in the previous slide, I talked about the fact that we have to know that, okay, we have different classes, different classification of fibroid. And subserous is the one at the extreme end of the uterine wall. So the torsion, which is like the twisting of the pedunculated subserous myoma, can cause pain. Fourthly, we have myometrium contraction. You know, when something contracts, it's like it's squeezing. So contraction itself on its own can cause, like when the myometrium is, that is the muscle area of the uterus, is contracting to expel this myoma, it can cause pain as well. The next symptom, which is pressure effects. Pressure effects, we talk about the tumor itself. The tumor is a mass. And a mass, we know that around the uterus, there are other organs. We have the bladder, we have the ureter, we have the urethra, we have the rectum, and other organs surrounding the uterus. So when this myoma or tumor, however we want to call it, becomes so big that they fill the pelvis and press the ureter. And we know the ureter is necessary for urination, one of the pathways that you move from the ureter, then goes to the bladder and all the other things. Then if it presses the ureter, it can cause, or ureter or bladder, it can cause urinary frequency. So you see a person always running to the toilet. Oh, I feel like urinating. I feel like urinating. They might get there, you realize, okay, it's not coming out, something like that. So it can cause that. So that's one of the symptoms of this pressing. The mass is so big that it begins to press other organs surrounding it. You see urinary retention, hydronephrosis. All these are related to the bladder, ureter, and urethra, and the whole urinary system. That's these three symptoms: the urinary frequency, the retention, and hydronephrosis. And when this tumor presses the rectum, it causes constipation. Cervical tumor may also cause dyspareunia and infertility. Dyspareunia is like painful intercourse. That is one of the symptoms as well. Next on our symptom list is infertility and spontaneous abortion. We know that when this tumor is there in certain areas, imagine a tumor that is in the fallopian tube area, it can prevent fertilization. So this myoma compressing the fallopian tube can cause uterine deformation, and submucosal fibroids can prevent implantation. And imagine a fibroid occupying the space that a child or a fetus is supposed to occupy. It would prevent implantation and the ongoing pregnancy. And also it's known, or it's a fact, that when there is someone that has fibroid, the incidence of spontaneous abortion is 2 times more than someone that has normal pregnancy. Next is anemia. Anemia as a symptom of fibroid is, as a result, is, I would say, is secondary to prolonged heavy menses, which is menorrhagia. Because for a long time, imagine a person, like we said at the beginning, abdominal uterine bleeding. This person has been bleeding, having heavy flow for a long time. And it's not, even though they compensate by taking enough food and vegetables, for that month, it's like a constant thing. And we talked about spotting. Spotting can occur. Imagine spotting, then you have your heavy flow. At the end of the day, it might result in iron deficiency, anemia. So anemia is secondary to the AUB, which is abnormal uterine bleeding. So in summary, the fibroid symptoms, so that I would remember, I used FIBROIDS to actually explain it. Firstly, F, frequency and retention of urine, hydronephrosis. For I, iron deficiency, anemia. For B, we have bleeding abnormalities. For R, reproductive difficulties. For O, obstipation and rectal pressure. Obstipation is like a chronic constipation, so it's the same thing as constipation. I, infertility, like we said, failed implantation, spontaneous abortion. D, dysmenorrhea, which is like cramp, when some people have like serious cramps during menstruation, which it's not really okay. So that's one of the symptoms of fibroid. Dyspareunia, like we said, is like painful intercourse. They have pain during sex, or even it can be before, during, or after. So that's what dyspareunia means. S, it can be symptomless. That's one of the summary of the symptoms of fibroid. So now we'll go to the signs. The first one, which are the symptoms. Symptoms are the things that you tell the doctor, okay, doctor, I feel like this, I feel like that. But signs are what the doctor sees by himself or herself. You see the enlargement of uterus and the mass move together with the uterus. You see, like, because it's a tumor, and it can be big, it can be small, whatever, it can move with the uterus. That's one of the signs of fibroid. Then how do we diagnose a person as fibroid? Based on the symptoms, based on the signs, based on by manual examination. This is done by the doctor or health practitioner. Also, we can use ultrasonography, which is going to the hospital, and I don't know if you know it, but it's like I don't know how to explain. Maybe I should have attached a picture actually. So ultrasonography can be used, like ultrasound. MRI can be used. Stereoscopic examination and laparoscopic examination can be used to diagnose fibroid. Then how do we treat fibroid? You cannot just, I know some people are scared, oh, if I have fibroid, they would cut off my womb or remove it or something like that. But not all fibroid needs surgery. Not all fibroid needs surgery. They are conservative treatment, they are expectant treatment, depending on the symptoms of the patient's age, the pregnancy status, desire for future pregnancies, general health, size, location, and state of the fibroid or leiomyoma. So the treatment in next slide, you see, if there is no symptom, because we know that fibroid might not have symptoms unless there is something causing it, like we said previously. The symptom, if there is no symptom, you do conservative treatment. If there is symptom and it's very obvious the person cannot bear it, then surgery can be done. If the size of the tumor, it's big, surgery, because we know that when it's big and large, you can actually start pressing other surrounding organs. So surgery can be done. If it's small, conservative treatment. Submucous myoma, it should be done with surgery, can dealt with surgery, which is based on location. Subserous, conservative treatment. And if the growth rate of the tumor is fast, then surgery should be done. And if it's slow, conservative treatment. So explaining the treatment in a little bit of bit and pieces, would say expectant management. In this case, for most cases of fibroids that don't require, most cases of fibroids do not require treatment, and expectant management is appropriate if there is no symptom. Myoma, if the myoma is small and the patient is post-menopausal, because we said at the beginning that fibroid regresses as the person goes to menopause. We are not saying that someone that is menopausal cannot have fibroid. Because we've seen a situation where there are some people, maybe after menopause, they want to do hormonal replacement therapy, because during menopause, the estrogen level has dropped. It's not as high as norm, as it's not like before. So because maybe some people don't want to, like, they want maybe because there are certain, like, how will I put it? There are certain symptoms that can occur because of this drop in estrogen level. Some people might decide to do hormonal replacement therapy, and people like that have the tendency to also have fibroid. So in a situation whereby a patient is postmenopausal, it can also be done that, okay, expectant management, but doesn't mean that someone that is menopausal cannot have fibroid. Also, in this situation, expectant management can be bed rest, hydration, and pain reliever. Maybe just rest a bit, take water. Even when the pain is not as severe, they can just take mild pain reliever. And in this situation, follow-up should be done every 3 to 6 months to monitor the size and growth of the tumor. Medical therapy. GnRH, which is gonadotropin releasing hormone agonist, can be administered in a situation whereby the person does not want to do surgery. And we know that we talked about conservative treatment. If there are other things that can be done that is not as serious, you can also do conservative treatment. And conservative treatment can be administering gonadotropin releasing hormone agonist to the patient. And this can shrink the fibroid and decrease bleeding by decreasing circulating estrogen levels. Because we talked about estrogen at the beginning, which high estrogen can also result in causing fibroid. And also, we should note that tumors resume growth after the medication are discontinued. So it's important to actually continue with the medication. If the medication are discontinued, there's every tendency that the tumor can grow back. For women nearing menopause, shrink fibroid prior to surgical treatment. So it's important to shrink the fibroid by administering this agonist, gonadotropin releasing hormone agonist, before the surgical treatment of uterine fibroid. And lastly, surgery. Surgery can be you can actually do hysterectomy, myomectomy, or depending on what the health practitioner wants for the patient, or however they feel like, okay, this patient is going through this and want to manage it this way. And even for the surgery or whatever, it's dependent on, does this person want to still give birth? Because we cannot just, there are people that maybe they are already like menopausal and it's affecting them so bad, they can do hysterectomy, which is like removal of the womb. But for people that want to still give birth, they can do myomectomy, like just focus on the part of the uterus that has the tumor, then remove that part. And that is it for that. In conclusion, we should know that fibroid is very common and is a non-cancerous tumor. Some people feel very uncomfortable talking about it, but you should know that you are not alone. There are people that have it, although the whole world do not have it, but there are people that do have it. And talking to people, finding support, education, and encouragement can also help. And like I said, it's important to visit the hospital when you notice that there is any irregularity in your body, because we talked about the fact that this is caused by is known to be caused by hormonal imbalance. So when you notice that there is something wrong in your body and you notice any slight thing, it's important to go to the hospital and do checkup. And we should not wait till everything has finished, like everything has we know that, okay, it has passed what we can handle before we go to the hospital. So it's important to actually go to the hospital. And please do not Google your symptoms. When something is wrong with you, go to the hospital. You don't have to go on Google to say, okay, what is wrong? Google actually has a way of messing up the mind of a person. So with this, we have come to the end of this presentation. If you have any question, you can ask. We have able hands to answer our questions. I hope we learned a thing or two. Thank you so much for having me.
Thank you so much. Thank you so much, Dr. Faith. Please, as I've told you already, the Zoom that we